Thank you everyone for joining tonight. I am Dr. Emily Wood. I'm a board certified dermatologist as well as a fellowship trained cosmetic dermatologist. So one topic I just wanted to talk about tonight is I always get the question, what should I be doing for my skin, Dr. Wood? And that is a very broad question, but I think there are a couple of things that really make it easy to take care of your skin. And it really doesn't have to be as complicated as we might all think. So this will be fun tonight. We can dive into it, and then at the end, feel free again to ask me any questions that you may have, and we'll get started. Okay, so yeah, I mean, there is so much out there. Um, there's creams, there's masks, injectables, there's so many different things. And it can be really overwhelming and it can feel like, do I have to spend, thousands of dollars to maintain good skin health, to look good? And I really feel like it doesn't have to be that complicated. I say, really it's simple for good skin health. Using a really good medical grade sunscreen plus doing like a yearly Fraxel will keep your skin in very good skin health. I like to point out these two products. They are two of my favorite sunscreens. Um, the one here called Pavise is a beautiful product. It is a sunscreen as well as a treatment. And so it really helps maintain your laser results. And then also we have the Isden over here that I really love. Great for people who are active, golf, tennis, all of those things. And then pairing that with a yearly Fraxel, you will have great skin. Um, so what is Fraxel? So Fraxel is a laser. It is a fractionated dual wavelength laser, and it's actually customizable for all skin types and concerns. And so specifically tonight we are talking about Fraxel Dual. I want to make that clear. And so that is the two customizable wavelengths that you can really treat a lot of different concerns. And so in the hill country, pretty much everyone has some form of outdoor activity they like to do, whether it's pickleball, fishing, boating, golf, you name it, hanging out at wineries, if that's your thing. There's just there's a lot of outdoor activities that we do here, and hence lots of sun exposure, and that especially comes with living in Texas. And so Fraxel is just a great way to treat your sun damage, and it has a lot of other benefits too that we'll be talking about. So what all can Fraxel address? It addresses texture, it addresses skin tone, sun damage, brown spots. It also treats precancerous growths, also called actinic keratoses. Um, a lot of people don't know this, but Fraxel actually decreases your overall rate of skin cancer as well. And then we also treat scars with Fraxel, and those are usually either acne scars or sometimes it's also surgical scars or scars from a traumatic injury. So it has a lot of different uses and can be totally customizable for your skin. And I really like to highlight this because, like I said, there's a lot of different treatments out there. Not a lot of skin treatments address also the medical side of, dermatology, and that is skin cancer. And so Fraxel, this is a study that was done at Harvard and published in 2023, where they have a huge database of Fraxel patients because that's actually where the laser was invented. And they looked back at all of their patients who did kind of yearly Fraxels, and they saw that the patients that did a yearly Fraxel had about half as many skin cancers as those who did not do kind of a yearly Fraxel laser. So, I mean, for me, I'm like, sign me up. I've had a skin cancer before myself. Anything I can do to prevent future skin cancers, I think is a great added thing in my routine. And I'll be honest, I'm on the go a lot. Obviously don't want to, have tons of downtime myself. Fraxel is something that fits well into my schedule and that I try to make time for once or twice a year. Oh, thank you. Okay, perfect. Everyone can hear me. I was just checking, making sure. Good. Okay, and so just kind of what to expect for your treatment experience. So typically you come in, we apply a numbing cream on the area that we are treating about 1 hour prior to treatment. Treatment typically takes 20 to 30 minutes, and then we apply cold air during the treatment. Another option for comfort is also we have laughing gas available, and that is easy to add on to your treatment. And then afterwards, we apply a cooling gel to the treatment area. And then before we leave, we apply a tinted sunscreen. So that actually covers a lot of the redness before you leave. And really, you just look like you have a sunburn when you leave the office after the treatment. So it's not terrible. I would say the downtime is about 1 day of looking sunburned, about 7 to 10 days of having some coffee ground flakes. So it's really not bad. You don't have to take off days of work. You can still be in the sun. I recommend patients wear the tinted sunscreen that we recommend, along with a large, sun hat if you're going to be out, like walking your dog, or going outside. So it really fits into, most of our busy schedules. I know people don't have time to take off 2 weeks from work, so Fraxel really fits in nicely with people's busy lives. And so kind of another question is, what areas do we typically treat? We often treat the face and so sorry about that. Spam call. Let me get back to that. Okay, so sorry. So what areas do we treat? Um, so face is probably the most common. The neck, the décolleté being more the chest area. Which really I think it's really nice to treat your face, neck, and décolleté because that all just kind of goes together and we get a lot of sun damage there. We also treat the arms, the hands. For scarring, you can really treat anywhere on the body. Um, and then, of course, there are special cases where we treat other areas as well. So this is a patient that I treated her chest. So she had, quite a bit of brown spots, sun damage, and that before and after is just with one treatment. So really nice result there. Um, and then this is a patient, she kind of just does her yearly Fraxels, but you can see really nice cleanup of the brown spots on her forehead. Her skin tone overall looks more even. This next picture is even close up. You can see her cheek here, just like smoother skin. The texture is so much improved. The brown spots are better. Her wrinkles are softer. So it's just a great all-around treatment. This is another patient, just lots of freckling, lots of sunspots on her face, and with a really beautiful result. You can also appreciate just the luminosity of her skin, and that's just from one Fraxel treatment as well. And this is another really good side view. So lots of freckling here on the face. And then this is her after. So great result. This is a patient, I treated her acne scar. So you can see she had, a lot of textural changes here on the cheek. And then this is with no makeup on, and this was after 6 treatments. So I will say, scarring or acne scars typically takes between 3 to 6 treatments. But this patient felt much more confident to not have to wear makeup. Her skin was smoother and just an overall great result. And you can see here too that she has a more olive skin tone. So again, you can actually treat all skin types with this laser safely. So, hopefully that kind of gave y'all a really good overview of Fraxel. And just as a thank you, I wanted to include 20% off either a single treatment or a package. So a package of Fraxel treatments is 3 treatments. You must book by September 30th. So that's just calling to book for your treatment to be by the end of November. So you have some time to get in and take advantage of this. And then this will be at the Marble Falls office with myself. Um, and then for booking, that is our number. I believe you'll also get an email after attending tonight. And if you have any specific questions, we'll see if anybody has any. Feel free to shoot them in the Q&A box. And then that's my email here, woodteam@Westlake Dermatology. If you just want to shoot an email if you have a simple question and you don't want to ask it tonight, happy to answer it there. But again, I hope you all learned something. Again, skincare and skin health, it doesn't have to be so complicated. Really just doing, a simple Fraxel laser like once a year is going to keep your skin in very good health. And we also do have both of those sunscreens that I mentioned. We carry those here at Westlake. So now we can do some questions. Let's see. Let me just get out of this. Okay. Let's see. Okay. Okay. Let's see. Okay, so let's see. One question we have is the numbing cream okay while breastfeeding? Yes, it is. And basically what I recommend to patients is you can pump and dump after the treatment, and honestly, minimal amounts of that numbing medication are going to be transmitted through the breast milk, so it is safe to do. Um, let's see. Good question, though. And then cost of treatment, it varies a little bit based on area, but for instance, the cost of a full face treatment for one treatment is $800. So with the special, you'll get 20% off. So that really is just something that I wanted to offer everyone for attending. It really never comes up, so try to take advantage if you can. Yeah, so the coffee ground flakes, good question. That is just kind of after the treatment. If we're treating more of your like sunspots, they're going to flake off and look just like fine little coffee ground flakes on the skin. And those take about 7 to 10 days to peel off. So it's, I think, good for people to know that you're not going to have like sheets of skin peeling off. It's just going to be fine flaking. And then you're able to cover a lot of that flaking with the tinted sunscreen. So, you can go back to work, you can be in kind of your normal environment and not feel like you have to hide out for weeks. Um, yeah, good question. If you have a history of skin cancer, would insurance cover Fraxel for medical reasons? I think they should, and I wish that they did, but unfortunately they do not. Um, So again, like the cost of a face treatment is $800, and then you would get the 20% off. Let's see. Question about the coffee ground phase of Fraxel recovery. Someone did Fraxel 12 years ago and thought that the dark spots were a hyperpigmentation issue. I will say if you are a more olive skin tone or you've ever had problems with hyperpigmentation, I have special protocols that I will recommend for you after treatment to prevent hyperpigmentation. So that's, any laser and you're treating a more olive skin tone, that can be a risk. Um, but typically I will prescribe you a cream called hydroquinone, and that typically minimizes the risk to almost none. So that might have been what you experienced, but typically the just normal healing part is that you have these flaky, slightly darker spots that we describe as coffee grounds, that heal over about 7 to 10 days. Okay. Does it help to take pain reliever? Usually, I actually have. So the question is, does it help to take a pain reliever like a leave before treatment? Um, we have some in-office pain medication that we can give you. We actually have a medication called Toradol, which is a form of kind of a leave, but it's injected, and we have that at no cost in our office, and that can help. And then there's also the laughing gas. If you are someone who's like, I don't want to feel anything, Dr. Wood, the laughing gas really helps. And so that's easy to add on to your treatment. We can always add that. And so I think with those two things plus the numbing cream, you'll do excellent. Another question, can I book and pay before September 30th, but do treatments January, February, March? The treatment kind of needs to be for this special, November, possibly early December. If you have special circumstances, feel free to, reach out to myself or Lindsay, my manager at our Marble Falls office. I believe her email's attached to the email you'll receive once we're done. And so if you have like travel or something, I'm sure we can work with you. Um, okay, another good question, is this preferable over Halo or BBL treatment? Um, so BBL is more kind of in the realm of the intense pulse light or broadband light, and then Halo is kind of similar to Fraxel, a bit different. I really like Fraxel because, again, it's been one of the only lasers that's been studied for specifically also reducing skin cancer risk. Plus, it has the great benefits of, improving sun damage texture. So that is what I prefer, just because it has, some of those really good studies behind it to show that it does help reduce skin cancer. Let's see, these are all great questions. Thank you all. Um, so another question is, how many sessions are recommended for boxcar acne scars? So it depends on the patient. I usually tell acne scar patients that I would at least plan for 3 treatments, and then we will reassess and kind of see how your progress is going. Um, Everyone's different, and then I would say with scars, you can always get subsequent improvement with more treatments. So we will continue on our journey together until you're happy with the way things are looking. But generally, it's maybe around 6 treatments. Does the special apply to the Houston office? Unfortunately, no. This is kind of just a special thing that I am offering to patients, so it would just be in our Marble Falls office, which is beautiful. It's worth the drive. I would definitely make a trip out here to come see us and enjoy the views and enjoy a Fraxel. Another good question. Is it best to do in the winter when your tan has faded? Good question. I would say just you kind of want to be at your base skin tone, what you normally are. So if you have been in the sun quite a bit, I would wait to do it, when you maybe haven't necessarily come back from like a beach trip or something. And then how long to wait between treatments? Um, the treatments are usually spaced about a month apart, sometimes 4 to 6 weeks, but generally that's about how long treatments are spaced. Other question, are other locations offering discounts? So we're the only location offering the 20% off, and that's just because I have extended that offer. So I know it's far, but it's worth the drive. You get 20% off. Like I said, we really don't ever offer that. So it's really nice savings. But I understand if you can't make it. I think the current special for the rest of the month is 10% off, but that 20% really helps it be much more affordable. Let's see. How does Fraxel Laser compare with CO2? So CO2 is great. I like CO2, but it has quite a bit more downtime. So, you know, whenever I am doing a CO2 treatment, I'm being pretty aggressive with it because the patient typically wants that. So usually a CO2 treatment is going to have a month of no makeup and your skin is pretty pink. It's usually about 2 weeks of, oozing scabs, vinegar soak. So CO2 laser is typically much more involved than the Fraxel dual treatment. But great question. What is the cost of the three package? So the package of three is 2,400 typically. That's when it's not on sale. So you would be getting 480 off of that. So it comes out to be like 1920. Um, Good question. Do the spots come back in time? You recommend Fraxel every year. Yeah, so for myself, I just think that I still go on walks outside. I think we all do a lot of outdoor time. So you get new spots, and so that just helps kind of maintain your skin health. Fraxel also builds collagen too. So I try to just manage to do it once a year to maintain things because unfortunately none of us live in a bubble. We all have to live our lives, enjoy yourself, and then Fraxel will clean up the damage. Um, can you drive home? Yeah, that's a good question. So you can drive home after the treatment. You don't need anyone to drive you, even if you get the laughing gas that wears off very quickly, within about 5 minutes. So you can drive yourself home. Let's see. Can you wear makeup after the treatment? Um, Yeah, so for the first couple of days, I recommend this tinted sunscreen that we sell in the office. And then after, like a week or so, you can usually go back to your usual makeup. But the tinted sunscreen, it's honestly like a lot of my patients have switched over to that sunscreen as their usual kind of makeup routine because it's lightweight, it gives them good sun protection and it gives them some coverage that's not too thick and heavy like a thick makeup. Um, let's see. What is the cost for face and neck together? So face and then neck is also 800, so you would be getting, 20% off each of those. Um, Another question, what about compared to MRN with Airy Essence? So, um, I think you're speaking about microneedling with Airy Essence. Ariescence is a platelet-derived growth factor, so it's typically after someone's undergone microneedling, and then you apply this platelet-derived growth factor. There are a few studies to support it, improving collagen, but it really doesn't, that treatment doesn't do much for sun damage, and it has no impact on your skin cancer risk. I don't think that it really compares to the Fraxel. I think Fraxel has a lot more research behind it and does a lot more for the surface of the skin. It's a fairly new treatment that there honestly aren't like a lot of great larger studies supporting its use. Um, is one treatment per year good for anti-aging maintenance? I think 1 to 2 times a year is perfect. I mean, once a year is great. Like if you can fit that into your schedule once a year, you are doing awesome. So, of course, some patients come in with baseline, like more sun damage than others, so they may need a series. But for a lot of people, just one treatment does great. How far apart do you recommend treatments? So the treatments, usually 4 to 6 weeks is kind of how we space our treatments. If we give you the IM Toradol I was mentioning, someone asked me if you need a driver. You don't need a driver for that. It's basically like a stronger form of ibuprofen, so totally fine to drive. Another good question, the laughing gas, it is extra cost. It's 125. The injection of pain medication is not an additional fee. So, um, let's see. It is another question. Is it safe after Botox? Yes. So you can actually do Botox on the same day. The order of how we would do it is we would do your laser first and then Botox. If you've had Botox before, as long as it's been 24 hours, you are safe to get a Fraxel. Um, let's see. I think last question is, does the package of three work if you wanted to do face, neck, and décolleté? I think it would come out about the same either way with the 20% off. Um, so it should be, yeah, the same either way. You would either just tell us, you want to do all three or you're wanting a package, but it should come out with the same savings. Is Fraxel good for necklines and sagging neck? So yes. So I will say, I have actually, I was a part of a study where we were looking at Fraxel for treatment of like the tech neck lines, like the horizontal lines that go on your neck. And I think it actually works really good for that. And it's one of our better treatments for that. Now, for actual like looser skin, I would say probably need something different for more sagging, but for the kind of finer lines, it does work well for that. Yeah, I think we've covered most questions. These are all great questions. Let's see. And then again, if you have more specific like cost questions, call our office and our team is really good at, helping you figure out what works best for you. And then if you have any scheduling, issues, we can definitely work with you. We want you all to be able to take advantage of this special savings. But let's see, we're at 6 o'clock. So this was fun. I enjoyed talking about Fraxel again. It's one of my favorite treatments. It's definitely on my like must have, must do list that I make time to do my own Fraxel every year. And it's what I love for my patients to do as well. Thank you all for attending, and I hope you all have a good evening and reach out to us if you have questions.